Hi, I'm Dr. Brandon Bukowski, an orthopedic surgeon with Mayo Clinic Health System, and I'm here to answer some important questions you may have about robotic-assisted surgery. When people think about robotic-assisted surgery, they think a robot operating autonomously, but that's not the case in orthopedic surgery. Instead, think of the robotic-assisted portion of the surgery as a tool that I use to help assist me make accurate cuts, assess the balance of your joint, and accurately restore your anatomy to give you the most optimal joint replacement. While there are several benefits to robotic-assisted surgery, I think some of the important ones for the first time really ever in joint replacement surgery, it allows a surgeon to reproducibly, within 1 degree and 1 millimeter, execute a plan. And so what that allows us to do is perform a joint replacement surgery that is very custom to the patient. So we're now able to reliably do a procedure that restores that patient's anatomy. We all have different hips, we all have different knees, and each hip and each knee requires something different. What robotics allows us to do is think very critically about what each patient needs, and then go execute that plan with a high amount of precision. Anyone who's a candidate for a traditional joint replacement, whether that's a hip replacement, a knee replacement, a partial knee replacement, is a candidate for robotic-assisted joint replacement. So anyone who would be considering one of those procedures is a candidate for a robotic-assisted total hip or total knee replacement surgery. So think of it as a new technique, not a new surgery. The recovery after robotic-assisted joint replacement surgery is certainly individualized to the patient. But one of the benefits of robotic-assisted surgery is it does often allow us to do less manipulation to the soft tissues in and around the joint. So an important thing to remember about a joint replacement procedure is that while we replace the joint and the joint surfaces, we don't replace the soft tissues. But by using precise techniques that robotic-assisted surgery allows us to use, we can often do less manipulation to the soft tissues in and around the joint, which allows for less pain and potentially a quicker recovery after surgery. To learn more, please click on one of the links on the screen or in the description below.